Hi, this is Town of Islip Supervisor Angie Carpenter, and welcome to this edition of Supervisor Spotlight. And here with us again, sort of have mixed feelings about that. You're delightful to have on the show, but the topic is something I thought we would be over with by now. So we have Chris Raio, Dr. Chris Raio, who is head of emergency medicine for Catholic Health, particularly at Good Samaritan Hospital, and here to talk about COVID and the variant, and here we are again. How have you been?
I've been good. How have you been?
Very well, really well. You're
Great.
looking very fine, very fine indeed. So here we are. We're like 18 months into this.
Yep. It's hard to believe it's been that long.
It really is. It really, really is. So let's start off with the variant. Where are we? How did we get here?
So obviously all over the news is the Omicron variant, which definitely is a little bit cause of concern, but I think definitely no need to panic. I think we're in a much better spot now than when the coronavirus first hit us. So, you know, I think all of the physicians, scientists, et cetera, are certainly more on top of things. And I think, you know, while we may see increased cases, we may see a surge, which we are beginning to see now. I think everybody needs to remain calm, stick to the evidence-based science and medicine, and you know, we'll get through this just like we have gotten through everything else. And
I would imagine, you know, the protocol, as you're saying that, I'm picturing in the beginning, 18 months ago, when this all came upon us and we're scurrying about to do whatever we can to inform the public of the appropriate protocol, washing your hands,
Yep.
et cetera, doing videos about it and everything. But as the months progress, you know, we can't let up. We can't start getting lax
Correct.
about some of those protocols, because as we saw last year with the flu, and now we're embarking upon the heart of the flu season, the numbers of cases of flu last year were down dramatically. Yep. Because of all of the protocol, the mask wearing, the hand washing, et cetera.
Right, yeah, and I think, you know, again, we have to stick to those basic, you know, procedures, washing your hands, you know, coughing, not coughing all over everybody, but protecting yourself and others. And then remember, we have now some tools, some weapons against the virus, so we have to keep pushing the vaccination. You know, everybody should be vaccinated if at all possible. Everybody should get the booster if at all possible. And then we do have some, you know, therapies against coronavirus that we can get into later that are also pretty effective. So again, we're in a better place now. So, you know, Omicron is concerning, but it's not something that everybody needs to jump up and down about it and get overly excited.
So we have Omicron, we have the Delta variant. Explain how variants come about and how one differs from another, if you would.
Sure. So that, you know, they have mutations which basically change some form of the virus. The Omicron variant actually has a lot of mutations, and that's the reason why we think that it might be more infectious, so it may spread faster. And then obviously the second question is, okay, well, if it spreads faster, is it going to create more severe disease? Or like you probably have read in the news, people think maybe it's a milder case of coronavirus. Unfortunately, I don't think we know that yet. You know, when these variants first pop up, they tend to cause more mild disease. But if you think about it, just logically, the people who usually get the virus first are not the sickest of the sick, right? Because they're usually, you know, in nursing homes or, you know, at home isolating a little bit more. So it's the younger people out and about that tend to get these variants first. So when they get it, they might not be as sick.
Gotcha.
But to say long term, is this going to cause, you know, a less severe illness or a more severe? I don't think anybody knows. I think people are leaning towards that it's going to cause a less severe form of the disease, but I don't think we'll know for 4 to 6 weeks.
Okay, so, you know, it could be wishful thinking at this point, hoping that it is not as severe. But again, back to what I said earlier, the protocols that we have all, you know, come to know and hopefully practice need to be continued going forward.
Absolutely. And hand washing would be number one. That's
Yeah.
something that,
I mean, and it's so
there's
simple.
really no
It's so
excuse.
simple.
No excuse not to be doing
Yeah,
that.
yeah. So I want to just take a little break here, and we will be back with Dr. Chris Raio from Good Samaritan Hospital speaking on COVID. Welcome back to Supervisor Spotlight. I'm Angie Carpenter here in the town of Islip, and with us today we have Dr. Chris Raio, who is Head of Emergency Medicine at Good Samaritan Hospital, part of Catholic Health. And we've been chatting here about the latest variant on the coronavirus. And, you mentioned earlier, Chris, that we have tools now, and obviously vaccination is, the best among them.
Yep.
So let's talk a little bit about that.
Yeah, so I think it's important that everybody knows that we're fairly confident that vaccination will protect against not only the former strains, but Omicron as well. So it's super important that everybody get vaccinated. And I think most experts think that the booster shot is particularly important at this time, again, to increase that immunity and work against these new variants that are coming.
I'm glad you said that about the booster, because and this is just anecdotally, in my circle, when it first became apparent that we should be getting the vaccination, people were scurrying to get that vaccine and get their second vaccine. But now it seems like, well, I've vaccinated, when I, just ask people, have you gotten the booster? And there doesn't seem to be that sense of urgency with getting the booster as there was with getting that initial vaccine.
Yeah, you're right. I think people are trying to sort of guess, well, I got vaccinated in this month and probably still have that immunity. I think just go on facts. We haven't seen any negative effects from anybody getting the booster. You should get the booster, boost the immunity, and again, particularly against these new variants, it's going to be important.
Well, especially now as we're coming into that time of the year, people are back inside. Holiday season is upon us. Holiday parties, family gatherings. You're going to be around people.
Yeah,
and
we are seeing increased cases coming into the hospital. Patients who are coming in who are at parties, at family gatherings, et cetera. The good news is that from the hospital standpoint, we're seeing definitely an increased number of cases, but not as great a rate of people who need to be hospitalized or intubated, et cetera, particularly among the vaccinated. So there's clearly protection if you're fully vaccinated.
But we're not out of the woods.
No.
People still need to get that vaccine, and if you've gotten it, get your booster.
And it's probably, let's be honest, it's going to probably be a yearly thing or a biannual thing. Unfortunately, I think when we first started to get to know each other, we hoped it would be a couple of months and this would all be behind us.
Exactly.
But it's looking like this is the new quote-unquote new normal.
So I don't know, how long has it been since the flu shot's been available, and people are going every year to get their flu shot, and you see the pharmacies hanging a sign out, free flu shots, et cetera. The doctors are giving them readily. That's been going on for years. And there wasn't this pushback, oh my God, don't tell me I need a flu shot, I'm not taking a flu shot. But people just routinely get their flu shot. So are you suggesting that we're going to have this with COVID? You need
I think
COVID
nobody
vaccine.
knows for sure, but that's the way. It's certainly pointing in that direction. I think some of that vaccine hesitancy was due to the fact that the vaccine was produced so quickly. But people have to realize when you start to do something over and over and over again, we have vaccines for all different kinds of things. Science has improved, technology has improved. They were just able to do it quicker. It's not that it's not as safe. It was just a faster process.
And two, it became very ripe for the political picking. It got to be a political issue that, unfortunately it shouldn't have.
Correct.
But I have a feeling that that played into it a lot.
Yeah, I'll leave the politics to you, I think. But from the
I prefer the governing. I don't like the politics.
From the science perspective, this vaccine is safe and it's effective, and unless you have some medical reason for not getting it, like an allergy or something, everybody should be getting it.
So, with everybody getting it, when we spoke last, I don't believe the vaccine was available for children. There was much discussion. They were working on that, and that would be the next logical step.
Yep.
So right now, it's 5 to 11-year-olds can get the vaccine. Where do you see that going? Has that caught on? Are people getting their
I think
children
people are getting,
vaccinated?
and I think it's going to be a slower process. It is true that kids are less likely to get very, very sick. My kids are vaccinated. I think, the way I look at it, I don't want to be the one person who didn't get my child vaccinated, and they're the one who does get very sick.
Well, now, I think that's very important to hear a physician say, someone dealing with this every single day, and especially on an emergent basis when you're seeing people that are really possibly critically ill, that you have had your children vaccinated.
Yeah, I want them as protected as possible. I want them, to be able to go out and do things, and I think that extra protection gives me a little more security in having them go out about, and live life.
Yeah. Would you say that for those that are hesitant to get the vaccine for their child, is there a cohort amongst children that have other health conditions, whether it be asthma, allergies, whatever?
Sure.
Would you say that really you may want to rethink your strategy?
Any child with any comorbidities, particularly those affecting the heart, lungs, they should absolutely be vaccinated. But again, even for the healthy child, I still think, the safety profile is there for these vaccines. I can't think of a great argument not to get it, other than if you want to bet that your kid is going to get COVID and not be seriously ill, which, it's a good bet, but not something worth betting on.
Yeah.
In my opinion.
Yeah. And I think there's been a lot of attention since COVID with mental health that perhaps we didn't have before, and it's something that's there. People have been shy to talk about mental health issues. If your back hurts or you're having any kind of health issue and you go to the doctor, there doesn't seem to be a stigma. But if someone is suffering from mental health issues, there didn't seem to be the willingness to talk about it. But it appears that since COVID has come on the scene, there's been more of an awareness of mental health issues, especially among the young and young adults. And I would think that if you have a child and you want their lives to be perfect in every single way, the stress and strain of living in an environment with worrying about, am I going to catch COVID, and kids wearing masks and being exposed to that worry that kids should be carefree and worry-free, and now, this is happening in our society that they can't ignore.
Right.
It seems to me that that would be even more reason for wanting to have them vaccinated so they can feel a little safer.
Yeah, and I think for the child themselves, I think they feel better actually. And I've spoken to a few kids, and they actually are happy that they're vaccinated, and it gives them a little bit of a security as well. And
we tend to forget how bright and tuned in to what's going on in the world around them than kids are today.
Right.
They're exposed to so much more than I was growing up, and even my kids were growing up, that you'd be surprised what they know and how bright they are and how threatened they might be feeling.
Absolutely.
And this is another tool to help them feel safe.
Yep. And again, in terms of which booster you get, if you're going to get the booster, I think it's important people just get a booster. If you had the Johnson & Johnson vaccine, it's probably better to get the Pfizer or Moderna as the booster, but not totally necessary. Just if you can get your hands on the booster shot, which everybody should have access to these days, just go out and get one. But there's nothing wrong with mixing and matching.
Okay. Well, we're going to take a little break here, And we will be back with Dr. Chris Raio from Good Samaritan Hospital to talk further on COVID. Hi, this is Angie Carpenter, Town of Islip Supervisor. We're here with our Supervisor Spotlight. And again, today we have with us Dr. Chris Raio, Head of Emergency Medicine at Good Samaritan Hospital, Catholic Health. And so we've been talking, obviously, about COVID and the vaccine and how important it is to get it. But also, you alluded to it earlier when you spoke about treatments, and that's the antibody treatment. How does that all work?
Sure. So for about a year now or so, we've been using monoclonal antibodies, which basically you're through an IV, through an intravenous, you're basically just giving people antibodies that will then help to fight off the virus. We're seeing really, really good success with it in terms of helping people feel better. So people typically will see relief in symptoms anywhere from 12 to 48 or 72 hours after the infusion. But I think more importantly, we're pretty confident that it helps prevent severe illness, hospitalization, intubation, and death. So, we're treating probably, around 50 people a day at Good Sam currently, and, at all our sister hospitals, they're doing pretty equivalent volumes to that. So if people are sick, particularly with comorbidities, it's highly recommended that they come in and get the antibody treatment.
So are you saying that 50 cases a day are being treated with antibodies?
That's the current volume at Good Sam now. That certainly has increased over the last couple of weeks, but that's approximately how many patients
So,
a
that's
day
a
now.
lot of cases,
Yep.
as far as I'm concerned. And does everyone who comes in with the symptoms of COVID getting the antibody treatment? Or are there more cases than just the 50 a day?
Most people will qualify, based on their symptoms. Are their symptoms worsening, their weight, their body mass index, if they have comorbidities, et cetera. I think it's scary to think, there's 50 cases a day. But again, remember, these patients are not sick enough where they need to be hospitalized. So that's a positive too. So, I think people are more comfortable coming back to seek medical care now. I think, there's a lot of awareness in the community that there are therapies that work. Our ERs, our hospitals are very, very busy right now, but I actually look at that as a positive, because if you remember at the beginning of COVID, a lot of people that had all these other medical ailments and conditions weren't coming in.
Exactly.
Now those patients are coming in, so we're basically pretty close to our pre-COVID numbers in terms of just patients excluding the COVID cases. And then we have these additional COVID cases on top of them. But again, sounds scary, 50 patients a day, but most of these patients, are not terribly, terribly sick. And the therapy works, so we're not seeing them come back and then have to be hospitalized. So I look at it as a positive.
So with the antibodies, people that have had COVID have the antibodies. And some people who have had COVID saying, well, I've had the antibodies, I don't really need the vaccine. What's your answer to that?
The answer is nobody knows how long those antibodies last, and you should still be vaccinated.
And should people be testing for antibodies?
At this time, it's not recommended routinely to test for it. I think nobody really knows what that result means. I think maybe you'll have some sense of protection if you test positive for the antibodies, but it's not recommended that that everybody just gets routinely tested to see if they have the antibodies.
You said something earlier about we don't, want to scare people, 50 cases a day, but you know what? Those that are out there that are listening and watching, you should be scared. If you haven't gotten your vaccine, you should be scared. Because that's a lot of people every day.
I think, and certainly more
diagnosed with it.
patients that are coming in are unvaccinated. The sicker patients are definitely not vaccinated. So again, we have the vaccine, we have the antibody infusion. You've heard about the two new drugs that Merck and Pfizer hopefully will be coming out with, these two new medic pills that potentially
Sort
can
of a
be
preventative.
No, they're actually used after you're positive.
Oh, okay.
The Pfizer medication we think will be hopefully out early next year. I think that one has the most promise and potentially can help reduce the course of infection and reduce serious illness as well. So, the medicine is progressing, and I think that's why we're seeing not less cases, but less hospitalizations, less deaths. So, I think it's all positive.
Well, I'm sure that ultimately that is the goal, and for someone like yourself that lives it every day, especially in a department like emergency medicine, which leads me to ask you to share what's going on there. Good Samaritan, I know that there has been a project that was approved for total modernization of the hospital and the campus and so forth. But before that happens, and I think the groundbreaking is scheduled for sometime next year, but there's a lot of exciting things that have happened in the ER, the pediatric ER, and some of the plans with the new emergency department.
Yeah, so we opened a brand new pediatric emergency department now about a year and a half ago. So, 12 beds, all private rooms, a lot more friendly environment for our children coming in to get treated, which I think was really needed for the community and definitely a big upgrade. But we're very excited, as you said, for a modernization project, which hopefully will break ground next year, which will basically be a brand new emergency department, about triple the size of what we have now. Brand new operating rooms on a floor above that, and then 3 floors of private inpatient rooms above that.
So if I remember rightly, the location of the operating suite is going to be a lot more conducive to where the emergency department is located, unlike what exists now.
Yeah, so the ORs will be right above us. So, a lot closer proximity if we need to rush a critically ill patient right up to the operating room. It'll be, a lot more efficient. We're excited in the ER. Obviously, we're a little space challenged now, but to be able to provide private rooms for our patients, just a better environment. The other thing that I think is important is to have this modernization project really allows us to help recruit top physicians, top clinicians, top nurses, et cetera. It's going to be a draw for us to help with that recruitment.
That's an interesting perspective because, when you're out there, and now, especially now, the job market, it's hard to get people for anything and everything, it seems. No matter where you go, you're seeing help wanted signs. I saw a sign flashing at the New York State Department of Public Works that they were looking for help. And, in years past, it was hard to get that kind of a position, and now they're, out there advertising, trying to hire. But the person's work environment plays a lot into a person's decision on where they're going to work. And in something so crucial as healthcare, you want the best, the brightest, and you want to provide an optimal workspace for them. And quite frankly, that isn't always the case now.
Yeah, I think, we've been lucky right now. I wouldn't trade my team for any team in the country. I think that that's more, based on just the community living on Long Island. That's certainly a draw. But I think long term, as we've developed our trauma center, our cardiac center, our bariatric center, our stroke center. If you're going to draw the top talent, you need the facility to match the clinical expertise. And I think that's what this investment is for, and we're all really excited about it.
And the mission, being very patient-centered.
Absolutely.
Certainly, you see it and you feel it, but it's difficult sometimes when a person's in a 2-bedded room as opposed to a private room. And if I understand correctly, with this modernization project, all the patient rooms, not just in the ER, but the patient rooms will be private rooms.
Yeah, all the rooms will be private. And, from the patient perspective, even if you're coming to the ER with a cold or a little cut, that's a very traumatic, anxiety-provoking
Oh, sure.
experience. And to provide an environment that's calming and private, and you can be just with your family or friends or whatever, it's just going to provide a much better patient experience, and that's really the goal.
Yeah. Well, certainly the private room's going to go a long way towards that. And it's interesting, there was a lot of outreach to the community during this whole process because it is a big project.
Mm-hmm.
And normally when you propose something like that, there's a lot of pushback. But I will say that the team at Good Sam did an extraordinary job in getting out into the community time after time, you know, answering questions, explaining what was involved, and quite frankly, getting the buy-in from the community, because it truly is a community-focused hospital there for the community. And we are really very blessed in the town of Islip to not only have Good Samaritan Hospital, but to also have South Shore University Hospital in Bayshore. And not every town in this county or in this island can say that.
Yeah, I mean, I think the team did a great job, and we look at the community as our partners. We want to work with the community on projects, and I think it's going to be great for both sides.
Good. Well, I really have to say I can't say how much I appreciate you coming down again, and would ask if you have any closing words to maybe encourage anybody out there who hasn't been vaccinated. Please, maybe you can appeal to them more than I.
I think there's no reason not to. So, you know, from a safety perspective, the vaccines are safe, and if there's no medical reason why you can't be vaccinated, you should go out and do it.
And to please remember that Dr. Chris Raio, who is extraordinarily credentialed and who really, really cares, I think that it's safe to say you truly care about your family, because when I hear you talking about your wife and your kids, I know how much you care, and his kids are vaccinated. So I think that really, really says a lot.
Yep, absolutely.
So to everyone out there watching, I thank you and really take this opportunity to wish everyone an absolutely wonderful, wonderful holiday season. We just finished up with Hanukkah, and we're looking forward to Christmas and Kwanzaa and the New Year. And so again, thank you so much, Chris.
Thanks for having me, and happy
today.
holidays to you.
Thank you. Thanks so much, and thanks for watching.